Hi, my name is Jessica Weniger and I'm the physician assistant at the MedSpot Northwestern. I'm here to talk to you today about Botox and to answer some frequently asked questions about it. Botox is a neurotoxin that's used to relax targeted muscle groups that are associated with fine lines and wrinkles. They're used in the areas around the eyes for the crow's feet, in between the eyes for the frown lines or the 11s, the horizontal lines on the forehead. They're also used for excessive sweating of the underarms and the palms of the hands. It can be used for a gummy smile, so when patients smile really big, that it shows a big portion of their gums, we can lower the lip for that. And it's also used in the masseter muscles to help with pain that's associated with clenching and grinding of the teeth, and also to help contour and add some facial slimming. Botox, Dysport, and Xeomin are all neuromodulators. They basically differ on a molecular level, but they essentially all provide the same end result. Botox and Dysport, the main differences are that Dysport tends to have a faster onset, so it kicks in 2 to 3 days versus Botox that can be about 5 to 7 days for it to be in effect. The other main difference between Botox and Dysport is that units are not equivalent to each other, but that really doesn't mean much for the patient. It's something more that the injector needs to be aware of. Botox, Dysport, and Xeomin all have about the same longevity. It lasts an average of 3 to 4 months. For some patients a little less, and for some patients a little bit more. As far as cost is concerned, Botox varies greatly from patient to patient. It depends mainly on the area that we're treating and also how strong the muscle groups are in that area. But to give you an average, for the frown lines or the 11s between the eyes, you would be looking at about $225 to $400 a treatment. Please come in to see us at the MedSpot Northwestern for a complimentary consultation to determine the appropriate treatment for you.